Thank you. I'm Stacy Dusetzina. I'm an associate professor of health policy and Ingram Associate Professor of Cancer Research at Vanderbilt University School of Medicine. And today I want to talk about gaps in access to care for uninsured and underinsured Americans. Just a quick note on my disclosures. So today I'm going to cover a lot of ground. I'm going to talk about some of the key gaps in health insurance coverage that I think particularly affect people with cancer. I want to talk a little bit about employer-sponsored insurance, where there are some challenges around access to health insurance itself, including the need to be and stay employed when you're undergoing cancer care. The fact that people with lower pay tend to have less generous insurance benefits and coverage, and that we have seen a trend towards higher deductibles being placed on these plans in an effort to keep premiums low, but this can result in access problems for people who lack available savings. I'll also talk about the Medicare program and specifically choices that are being made among people looking at Medicare traditional program versus Medicare Advantage. Medicaid, I'll mention, especially thinking about areas where access is quite good overall, but where people may struggle with issues related to other costs associated with care, such as transportation and parking, or the fact that enrollment may be less stable, where they may not know if they are insured from month to month. And I will spend a very limited time talking about the uninsured, except through pathways to improve access to health insurance, as paying cash is really not an option for people undergoing cancer treatment. So I want to talk about opportunities to increase access to care, but also to improve health equity. And the first place where I'd like to spend time is talking about Medicaid expansion. In 2019, about 14% of adults between the ages of 18 and 64 did not have health insurance, despite the Affordable Care Act's expansion of coverage. 74% of people report that this was due to their not having access to affordable coverage for them, and another 25% say that they do not actually have eligible options for health insurance. So though the ACA did expand access to care, the way it was implemented allowed states to opt out of Medicaid expansion, which has left these orange states shown on the graph vulnerable, and people in those states vulnerable, because those with incomes of less than 100% of the federal poverty level do not receive any subsidies if they try to purchase health insurance through the exchange. This truly means there is no affordable health insurance option for these individuals, who are disproportionately Black and Hispanic individuals. So one pathway to improve access to healthcare and reduce inequities is through Medicaid expansion in these areas. I next want to talk about improving access to Medicare coverage and specifically improving the generosity of coverage or better selection of benefits. So this is a bit of a busy graph, but it shows the reported cost-related problems in Medicare by the type of plan you're in. What we find is that about 1 in 6 Medicare beneficiaries overall report that they have healthcare cost-related problems in 2018, and Black beneficiaries were twice as likely to report these problems as white beneficiaries. But one of the most striking findings is that the people reporting the most trouble are those who have a traditional Medicare plan without a supplement, this bright blue bar to the second to the left in each of the graphs. For these individuals, they have to pay 20% of all services that they receive, including all cancer-related care, which can be quite unaffordable as we think about all of the healthcare needs. So for people with cancer, it's important that they be able to get into a plan that better meets their needs. And this includes often traditional Medicare with a supplement or Medicare Advantage. Though there are concerns for Medicare Advantage enrollees that they may not have their appropriate cancer specialist in network. This can also lead to extensive out-of-network charges and high out-of-pocket costs. One more policy opportunity I'd like to mention in the Medicare program is improving the Medicare Part D benefit. So this benefit is how older adults receive prescription drug coverage in the US today. There currently is no cap on out-of-pocket spending on drugs filled in Medicare Part D, and this includes a growing number of cancer drugs. From some recent work that we've conducted that's currently under review, we've found that 1 in 3 Medicare beneficiaries don't fill their prescriptions for anti-cancer medications. And that this is really distinct for people who have low-income subsidies versus those who don't. So those without subsidies are about twice as likely to not fill their prescriptions as those with subsidies. So a cap on out-of-pocket spending in Part D could improve access to these drugs for all Medicare beneficiaries. Finally, there are some policy opportunities for thinking about improving employer-sponsored insurance to make that more accessible and equitable. One opportunity is to think about taking high deductibles that are offered on commercial plans and breaking those up into monthly deductible limits. This would ensure that people who had a very high cost month did not face a tremendous amount of out-of-pocket spending. Another opportunity is to think about tailoring the out-of-pocket maximums to account for the fact that people with cancer may have multiple years of having very high out-of-pocket costs, which could be unsustainable in the long run. And finally, it's important to think about network adequacy and the availability of supplemental coverage. So many plans, in an attempt to lower costs, may carve some specialists out of their health system networks, but this could reduce access to cancer care for some beneficiaries. And it's important to make sure that these networks stay strong so that when people need specialty care like cancer care, that they have access to those professionals. Thank you very much. I look forward to having a discussion.